Hi everybody, this is Kelly Dean from the Tummy Team, and I want to talk to you about our professional training options. I am a physical therapist. I've been a physical therapist since 1996, and I am passionate about the core. My business is the Tummy Team, and we specialize in diastasis recti rehabilitation, but also the bigger picture of functional core and functional pelvic floor rehabilitation. The reason that we started doing professional training is because there is an obvious missing link. I, as a physical therapist and having years and years of experience, realized that I had minimal education and resources related to diastasis recti and what it really meant. And it wasn't until I suffered from it myself and had a 6-finger wide diastasis and went to some phenomenal physicians and surgeons and physical therapists and birth professionals and fitness professionals, and no one knew much about it. And what everybody knew was contradictory or conflicting information. And it sent me on a journey to where I am today to really understand how to heal this condition without surgery and how to get updated information. So as we started doing this work, I never really thought that I would be training professionals in it because I felt like I was kind of learning as I went. But it's been really confirmed over the last decade by thousands of clients, as well as hundreds of medical professionals, that there's a missing link in our education. And that missing link is across the board. It's missing in the medical field, it's missing in the rehab fields, it's missing in the fitness community and in birth professional training as well. And all of those different professionals are involved with clients who have functional core weakness symptoms, functional pelvic floor weakness symptoms, and likely many of them are suffering from diastasis recti, and we simply don't have the education to treat them well. When we're faced with contradictory or conflicting information, usually a lot of professionals just kind of say, I don't know how to treat that. I'm not sure what to do with that. And there's multiple ways that kind of presents itself to a client. Sometimes we give them information like, there's nothing that can be done about it because we don't know what to do. Just because you don't know the information does not mean there's not a treatment plan available. You just haven't learned it yet. And we want to help you learn that information. We want to empower our medical and professional community to have better resources and have up-to-date information. And there is a missing link. When I went to a phenomenal physical therapy school, I feel like I had a very good, well-rounded education. But what I learned, and mind you, this was 20 years ago, what I learned was that I don't even remember learning how to check for the diastasis, but what we did learn was kind of having them come up into a full crunch position and to see if their stomach bulged or see if there was a gap there when they were in a full crunch position, which is actually not how we check for it anymore. And then we were taught to like wrap a sheet around the client's waist, have them pull the two sides together, and then do sit-ups or crunches or some kind of pelvic tilt, some kind of rectus abdominis work while we're approximating it with a sheet. And that feels kind of archaic compared to what I know now. And I for a long time thought, well, that was just because I went to school 20 plus years ago, and that wasn't a specialty of my school. But the more I talk to professionals, the more consistent that is the education that's still being taught, if any education at all is being taught about diastasis recti. And so why is this a big deal? Why do we need to change things? Why have we been on a mission to impact the professional community? Diastasis recti, which is the separation of the abdominal wall, a stretching of the linea albia, the connective tissue, is first of all completely treatable. But second of all, is always an indication of a bigger picture. And that bigger picture is functional core weakness or functional pelvic floor weakness. And usually those go hand in hand. Not all functional core weakness results in functional pelvic floor weakness, but it usually left untreated, goes down that path. So functional core weakness is a term that we've pretty much coined at the Tummy Team, and it basically means not having the strength of the core to do basic everyday activities without pain or dysfunction. So being able to lift your kids, being able to work without pain, being able to get in and out of bed, up and down the stairs, squatting, lifting up without pain or dysfunction. And so there's a lot of things that we have as a community and as a culture assumed are just kind of normal parts of our life: low back pain, sciatica, constipation, and maybe bulging tummies as we age or after we've had kids. Things like that we've kind of maybe minimized the impact of those types of symptoms. But those are all symptoms of a bigger picture functional core weakness. Functional pelvic floor weakness can present in prolapse, can present in incontinence, in pain with intimacy, pelvic instability, also intestinal trouble like constipation and other issues with the bowels. Those are all functional pelvic floor issues, as well as prostate issues. And those are all things that are connected to functional core weakness. And sometimes the first sign of this is a diastasis, is a separation of the abdominal wall. And the reason is, if we are not using our core effectively, our body uses alternate strategies to stabilize our spine, to hold our body upright, and to support our pelvis and our rib cage so our arms and legs can lift and push and move and bend and all the things it needs to do. And that alternate strategy is bracing, holding the breath, crunching, or bulging out of the abdominal wall, all of which put inner abdominal pressure out on the abdominal wall. This is not just a pregnancy issue, although pregnancy is a contributing factor, but we see this in men, we see this in kids, we see this in women that have never had kids or had kids years and years ago. If their body is forced to use an alternate strategy because it's not connected to the core properly, functionally, all day long in the things that you do all day, not what you do in the gym, but what you do all day long, it's forced to use another compensation strategy. That compensation strategy is pointing to a bigger problem that needs to be addressed. And when it's not, then we go down a path of other issues like compensation pain, disconnect from these muscles, chronic pain, structural breakdowns in the pelvic floor, and different things like that. Structural breakdowns in the connective tissue that lead to a hernia. A lot of this stuff can be addressed with proactive, intentional rehab and really being aware of what's going on in the body and what the body needs. So when we look at diastasis recti, we need to open our mind as professionals and look at all the different ways that this could be affecting your client. We have launched multiple continuing ed programs at the Tummy Team, and we've done it with multiple different types of professionals in mind, because like we said, the core kind of crosses over a huge span of medical professionals, from physical therapists and chiropractors and restorative fitness type rehab type professionals, to medical professionals like your primary care physician, maybe GI doctors, plastic surgeons, or osteopaths or orthopedic doctors that are looking at back pain and structural things like that, hip pain, pelvic pain, and then birth professionals, OBGYN, midwives, doulas, childbirth educators. And then there's the whole fitness community as well. And what are the personal trainers, the fitness instructors? Sometimes when people feel weak, they go to fitness when maybe they need rehab. And are our fitness instructors and our fitness professionals educated in the anatomy of the abdominals and how the core works and what a diastasis looks like and where the transverse abdominis is and how to activate it properly? So we have developed more than just a couple of continuing ed courses, although we do have those. We've actually designed an apprentice process at the Tummy Team where you can walk alongside me and the process that we've developed at the Tummy Team over years and years, and really learn how to implement this in a very clinically applicable way that's relevant to what's going on right now and is up to date to what we know about the core. So we really need to think differently about how to check for a diastasis, how often to be checking for a diastasis, not to be so aggressive when we're checking for a diastasis, looking at all the other symptoms that might be related to functional core weakness, looking at how somebody's multiple symptoms that seem kind of all over the place all maybe are connected in one place to the core and to how the core is helping or not helping them do their daily life. And we've created a process that helps you do it anywhere you live. It's completely online, and this has allowed us to train people internationally around the world. And we are really on a mission to change and to fill that missing hole that most of us, if not all of us, had in our training. This is more than back stabilization exercises that you learned in PT school. This is more than sending somebody to a plastic surgeon. This is more than assuming it's a hernia and putting a patch in there, or saying, you know, I don't know how to deal with that, or this is normal in pregnancy, you just have to deal with it. A diastasis can affect every stage of a woman's pregnancy, including fetal alignment, including pushing coordination, including being able to recover after delivery, being able to get pregnant the next time around. There's a lot of pieces to this puzzle, and there's a really great way to learn how to treat these clients better. And we want to be a part of that with you. So check out what we do at the Tummy Team. Recognize that just because you don't know yet how to treat this condition doesn't mean it's untreatable. It's totally treatable. I've healed my 6-finger wide diastasis. I've helped thousands of people around the world heal their core and be strong for the life they were meant to live. And I believe that I can help you help your clients get that, get those resources and get that knowledge, and for you to feel confident in what's going on with your client and how to treat them. So check out what we do on our professional site at thetummyteam.com. All right, thanks everybody. We'll talk to you soon.